Bobby is a couple of months past his 1-year follow-up from his second surgery, okay? Now, what's interesting about Bobby's procedure is, of course, we also built out the temples. Now, a lot of surgeons don't like to mess with temples. These are all rebuilt, these temples right here. All rebuilt, everything's soft and natural. And for Bobby, he chose the FUT method because he's online and he really didn't want to do anything about shaving his head. And, you know, we can go through here and see that, you know, we don't have any type of crazy scarring. You know, when it's done properly, you don't have to worry about that. Even if there were any scarring, there's things that we can do to correct that. But he's got, you know, very, very nice response. And again, even if there was a scar that ever bothered him, we have a very nice, unusual technique that we use to dissipate that scar, and it works beautifully. But the point being that, you know, with 2 procedures, we've been able to accomplish not only taking care of these temples beautifully, but giving him that hairline that he always really wanted. He wanted that strong, if you will, almost Elvis-like hairline. Now, my job was to make sure that he wasn't making a mistake. And so we had to make sure that we pushed the limits, but not too far. He's very pleased. We don't have any kind of unusual scarring, which people will sometimes use as an excuse as to why they don't want to do FUT. But I'm here to tell you that's not the case. And when it's done properly, you can do it very efficiently without any problems. But I just love the temples. I love how that blends. It's flat. No one would ever guess that's transplanted. And again, you know, looking through all of this, you know, and because he did the FUT, he doesn't have to worry about any problem with, you know, decimation of his donor. And, you know, overall, he's set. You know, he's going to stay on the finasteride. And really, I mean, he's locked in for, you know, I'd give him at least the next 10 years before we'd even have to consider anything else. And he's young, and this is important to him for his line of work. Didn't want to get the shave, so we understand that. And that's the importance of, I think, in any clinic or anyone that's really, you know, considering to call themselves a hair restoration surgeon. I think that, you know, you really should be adept at both skills. And this is a perfect example as to why. And also a great answer to the question and argument, oh, well, doesn't it cause terrible scarring? Well, the answer is no. When it's done properly, it looks beautiful. So again, I just, you know, that's just a great hairline. I'll take credit for it. I'm proud of it. I think it's fantastic.